This is Angela Gambrel, author of Surviving Ed, the Eating Disorders Recovery blog at healthyplace.com. And today I would like to briefly talk about making the decision to go into inpatient for treatment for your eating disorder, and also if you are struggling with what they call co-morbid disorders. That is, you happen to have another mental illness that you are struggling with, and sometimes it kind of combines with your eating disorder to make things even more difficult for you. I am going into inpatient today. I am getting ready to go. I'm packed, and I made that decision because of two reasons. One is that I've been struggling to eat and struggling to take care of myself and to feel that I deserve to eat. And so therefore I have had months of very little eating. In addition, I have also developed a substance abuse problem, specifically alcoholism. And that has combined with my eating disorder to make things very difficult for me. And one, because of the level of alcohol that I'm drinking, I'm afraid to eat because of the calories. So I'm really not getting any nutrition. I'm getting calories, but nutrition and calories are two different things. So I tried to make things work at home, and they just didn't, and it's been months of this now. So I made the decision to go into inpatient. And there's nothing to be ashamed of about going into inpatient, even though I'm feeling a little bit embarrassed about doing it myself. Because it's most important to take care of yourself. There's some specific things that you should go to inpatient directly at, and that is if you are suicidal or homicidal, or if you're thinking about harming yourself or another person, if you have become so enmeshed in your eating disorder that you're showing some really severe physical symptoms, such as perhaps throwing up blood. I had a friend of mine that did that, and I'm like, you really need to go to the hospital for that. That's something that needs to be treated. So I will be going in both for treatment of my eating disorder, anorexia, and treatment for my comorbid illness, which is alcoholism. And I just want, to stress that people with eating disorders often, when you're in recovery, you sometimes do slip into another disorder, often without realizing it's happening. And that's kind of what happened to me. It didn't, obviously no one sets out to become an alcoholic, no one sets out to become an anorexic, no one sets out to develop any of these illnesses. However, they happen, and it's not really within the scope of this video for me to decide, why they happen. Mine is more, they happen, and you have to take care of yourself. And when you realize that it gets to the point where you're not taking care of yourself and you're getting sicker and you're not going to be able to turn it around, then you need to make the decision to go inpatient. I hope this information's been helpful, and I will be returning on January 1st, and I will blog about my experiences in inpatient, to just give you an idea what it's like. It's nothing to be afraid of. I've been in inpatient before. It can be scary if you think about it, especially the first time. And sometimes you have to go multiple times, but hopefully I'm really, really hopeful. This will be my last inpatient admission, and I wish you all well and happy and safe holiday, and urge you to take care of yourself and to keep working on recovery, because we all deserve recovery from our eating disorders and recovery from our other issues, and I wish that for each and every one of you. Thank you for listening, and I hope, again, for the best for all of you.